Today we're going to talk about one of the most common cardiovascular conditions, coronary artery disease. Heart disease is the most common cause of death globally, and coronary artery disease is a big part of that. Coronary artery disease falls within a spectrum, essentially, of plaque building up in the arteries that supply the heart, but that plaque can also build up in other areas. We call that atherosclerosis. If it builds up in the legs, it can cause symptoms such as cramping when you walk. It can also lead to strokes when it affects the vessels that supply the brain. And when it affects the vessels that supply the heart, we call that coronary artery disease. The first sign of that is angina, which is chest pain, difficulty with exertional activities like exercising, feeling a little more short of breath. Sometimes our older patients may not have chest pain the way that you classically think of coronary artery disease or heart attacks. Diabetic patients, our older patients, sometimes the symptoms can be a little bit more difficult to describe. Sometimes it's more of a shortness of breath or tiredness. But if you're feeling any of those, particularly when you exercise, when you're going out for walks, when you're climbing stairs, going uphill, then it's definitely a good idea to get that checked out with a cardiologist.